You might be vitamin D deficient. What to do about it? What is vitamin D? Vitamin D is fat-soluble, produced in our skin on contact with sunlight. A study led by the University of Birmingham compared the ability of immune cells in blood from inflamed joints in people with rheumatoid arthritis to respond to the so-called sunshine vitamin. Maintaining sufficient vitamin D levels may help to prevent rheumatoid arthritis, according to researchers. Darker skin. You may need as much as 10 times more sun exposure to get the same amount of vitamin D as an individual with pale skin. Your skin pigment acts as a natural sunscreen, so the more pigment you have, the more time you need to spend in the sun. Recent studies have found that vitamin D might protect against heart failure, diabetes, and cancer. Hair loss. Vitamin D deficiency causes hair loss. Vitamin D deficiency has traditionally been linked to bone health, but it may also have a role to play in respiratory tract infections and autoimmune disease, among others. You're at least 50. 95% of senior citizens may be vitamin D deficient. The reason is not just because they spend a lot of their times indoors, another reason is that they produce less when they're exposed to the sun. Obese, overweight or high muscle mass. Vitamin D is fat-soluble, which means that the body will collect it. If you are overweight or obese, your body will need a lot more vitamin D than the average person. Many patients who visit their doctor and complain about aching bones and muscles are misdiagnosed with fibromyalgia or chronic fatigue syndrome. It's not an uncommon mistake, so before the doctor diagnoses you, ask for a vitamin D blood test just so you can rule it out if it comes back negative. You're depressed, especially in winter. Sweaty head. A sweaty head is one of the first signs of vitamin D deficiency. Excessive sweating in newborns that's due to neuromuscular irritability is still described as an early symptom of vitamin D deficiency. Gut issues. Vitamin D is fat-soluble, so if you are having gastrointestinal issues that affect your body's ability to store fat, you could have lower absorption of fat-soluble vitamins. Belly fat exposed. Lower vitamin D levels were significantly linked with fat in the liver and abdomen. Sources of vitamin D. Grain products, orange juice, plain yogurt, deli meat, beef liver, salmon, eggs, fruits and vegetables. Just remember, if you experience any of the symptoms mentioned, go consult your doctor, because you may be vitamin D deficient.